welcome. I'm Brittany Quemby, VP of Marketing at Healthcare IT Today. And today is such a special day because we are celebrating a major milestone over here, 20 years of healthcare scene, which is Healthcare IT Today. And to mark the occasion, I thought it would be great for us to sit down with someone who needs no introduction, but absolutely deserves one, our CEO and founder, John Lynn. John, welcome.
Yeah, great to be here, Brittany. It's been interesting, like leading up to this 20 years, because as I've talked to people at conferences, I'm like, yeah, our first blog post is 20 years this December. But for me, it's like all that really means is I'm old, I think.
No, it's a big accomplishment. And, I've heard bits and pieces of kind of like what we're calling the origin story over the years, probably, between conference chaos or, maybe we've even captured it in, somewhere, but never in like a formal setting. So, and honestly, some of the questions that we're going to talk about today, I don't even know the answers to. So I'm excited to dig in, and talk about how it all got started, what those early days were like, the surprises that you encountered, the lessons learned, all of that good stuff. So thank you for doing this. If we want to get started right into the nitty gritty, I'd love for you to just take us back to the beginning. So like 20 years ago, what was the moment or insight that actually sparked, healthcare scene, healthcare IT today?
Well, I mean, it really goes back to my childhood. When I was a child, I thought, when I grow up, I want to be a blogger because no, I mean, of course not. Like
It's like,
blogging
really?
didn't even exist as a child, right? Like it's so funny to think about. Like I was early in the blogging. In fact,
Mm,
when I was in Hawaii, before I even started into healthcare, I was working in Hawaii, and this guy said we should use WordPress for the university's website, and I was like, really? Is that a good idea?
mm.
And he did it for this like celebration of 50th year, and I was like, well, that's interesting. So when I moved to Vegas and started working in healthcare at UNLV, I played around with WordPress, and I was like, oh, I kind of see why this makes sense, right? Like it's really easy to roll out and things like that. Well, fast forward to that holiday season. I'm off work, and what do tech guys do when they're bored, and you have a free weekend and a free week with nothing to do. And I decided that weekend to start a blog about EMR,
Hmm.
because that was a really sexy topic. And no, but I was implementing EMRs at UNLV, and I was learning a lot of stuff, and I was like, hey, let me share my expertise, let me learn search engine optimization. That had been important to me. And I put ads on it from day one. I'd had another site, Crash Utah, which was something I built in college. It was kind of like City Search, which is still, that's outdated too, right?
Mm. Yeah.
It was like this City Search, or a way to look at activities in Utah County, where I went to college at BYU. Anyway, and I had ads on there, and Google Ads, you get your payment when you make $100, right? And I was
Mm.
about to get my second payment. I was so excited.
Ooh.
I was like, oh, I'm like 3 months away from getting my next payment from this. And I was making like 5 cents a day. It was like ridiculous. It's not even a
Right.
business or anything, right? But I was just teetering along, and I had that old site up, and I would make a little bit of money. Well, I started the EMR blog, and if Google's listening, I did not click on the ads, but I clicked on the ad, to see like what would the EMR ad on an EMR blog look like. And I clicked on it, and it was like $1.50. I was like, wow, this
Mm.
adds up a lot quicker than those 3 cent clicks, right? Or these 2 cent clicks. And so I was
Right.
like, maybe I could make a go of this. And so I did. For the next 6 months, I just hammered the site, like there was a forum called EMR Update at the time. It was like
Mm.
one of the first listings on Google for the search term EMR. And so I
Mm.
hopped on there, and there was all these EHR founders. EMDs was on there. I think Amazing Charts was on there. All these different, EHR vendors were on there and talking about what was happening. And so, anyway, it was crazy. I wouldn't say I started thinking, man, I'm going to build this, this publication and I want to be a journalist when I grow up. It was more
Hmm.
happenstance and just a bit of luck. I mean, here's how much it wasn't a business driven thing is I started the site at crashutah.com/EMR because I already had the
Mm.
domain Crash Utah and I was like, why am I going to pay $10 a year for this? It's like,
Right.
I mean,
Right.
it probably explains my approach. I'm pretty cheap, but I finally, a month later, I was starting to get checks from Google every month because I was doing pretty well. I mean, it was date money at the first 6 months, right? But
Yeah.
yeah, I finally purchased EMR and HIPAA.com, which will be nostalgic for some, including myself. So
Mm.
yeah, I mean, that's how it grew. And over the first 6 months, I made it to the first page of Google for EMR, and
Mm.
I was getting 1,000 page views a day, and it was doing well. And like I said, I had a couple advertisers, and I got a Google check every month, and I was like, this is good, But I was like, how do I scale it? Like, how do I do this?
Mm.
So I actually set it aside after that, and I mean, there's so much more to the story, but I went off and actually found some reality TV blogs, which some people know about if you've talked with me for a
Hmm.
while. Uh,
Yeah.
yeah, and then fast forward to the EHR stimulus. Well, at that point, I had two sites, EMR and HIPAA.com and EMR and EHR.com. Um, and once they said $36 billion of government money, the sites blew up. I have the graph. We can probably show it for to people
Mm.
if we want. But anyway, it was just crazy. Overnight, it went from under 1,000 page views a day to over 5,000 page views a day, and just blew up. And from that point, I posted every single day on both sites for the next like 4 or 5 years.
Hmm. Yeah, it's so wild to think about how, one small, you know, weekend or week off, like you said, one small spark can grow something into, a 20 year, company and publication and kind of everything that's happened since that time.
Yeah, well, and
And
it wasn't my vision. I figured it was just a resume builder. But
right.
once the stimulus package hit, I realized, hey, there's a lot more potential there.
Yeah, so let's talk about that. Like, what were the early days like? You said you had set it aside and then for 6 months you kind of, were working on it continuously. You know, during that time, was there a moment when you knew this was going to be bigger? Was it when the stimulus was announced, or was it something different when you were like, this is something I could really kind of sink my teeth in and grow in the industry?
Yeah, so I mean, certainly the stimulus package blew up the site, and it took me
Mm.
from, five advertisers paying me $50 a month to 10 to 15 advertisers paying me 400 or 500 a month, right? And
Mm.
to be frank, sometimes I miss those display ad days, It was really nice. You
Mm.
just, they'd buy a display
Set
ad
it
for
and
six
forget it.
months and then you say, see you, talk to you in 6 months, like
Right,
well,
right.
certainly they don't pay as much as like they're paying for videos and stuff, but it was a nice model, right? Like it was nice being able to just be like, all right, good, you're getting value and this is great.
Hmm.
But yeah, I'd say a few things happened. Ironically, when I quit the day job, I went to HIMSS. I was on a Meet the Blogger panel, my very first HIMSS in Atlanta, and they had
Mm.
these Meet the Blogger panels, and I was on one of them. And one of the people stood up and said, "Hey, how many of you do this full time? Like, is this a legit thing?" It was kind of the question,
Mm.
It's like,
Mm.
how many of you do it full time, and how many are just doing it as a hobby? And I was like, well, it's funny you asked that. When I get back from this conference, I'm quitting my day job, and it's going to be a full time thing. But the
Mm.
irony of this is I actually quit the day job to do a startup company. I just
Mm.
essentially figured out GoFundMe and I would realize people just want to donate to worthy causes and why are we wasting money on candy bars so that and then people don't
Hmm.
even get it or wrapping paper or things like that. So
Hmm.
I was building that and then the blogs and everything that was happening with the EHR stuff was essentially funding and paying for my family and things like that. And so like even then I didn't believe that it could be full time. I was going after this startup idea and certainly it made it possible so I could quit my day job.
Mm.
Well, then it grew to 100% of what we needed. And when I quit, it was about 75% of what my family needed to live. Grew to 100%. I was like, wow, great. I mean, even then, I was like, oh, I have unlimited runway for my startup, you know, like
Mm.
that was the view. But fast forward, like I went to a HIMSS and I probably did a faux pas because I wanted GE to advertise with me.
Mm.
And here's how it went. I was watching Meet the Press on Sunday, you know, and I saw an advertisement for GE advertising EMR on Meet the Press. And I thought to myself, GE must be paying like $5 million or whatever for this ad on Meet the Press. It's like they can't give me like 5 grand, 10 grand. Like, how is this possible? Like, I have the people that actually are buying the EMR.
I have
Like,
the actual audience.
yeah, exactly. And so it was really interesting. Like, I got pitched GE, a really nice policy guy, and he was great. He became a pretty good friend, and especially during the meaningful use days. And
Mm.
I probably did a faux pas. I was like, hey, you know, while I'm there, is there any way I could talk to your marketing person? And they were
Mm.
really nice. I said, sure, that would be great. And so they introduced me a nice lady named Kate, and went up to her, and she's like, oh, hey, John, I read you every day. I'm like, what? Like, so you read me, but you don't advertise with me. It didn't make sense, right? I mean, obviously, I wasn't in the media business. I didn't know how it all worked, right? And so,
Hmm.
long story short, I pitched them this package of advertising that they could do with me, and she's like, "Yeah, here's our agency. Let's definitely do something." And so they did, and I'd say that was like one of the big turning
Mm.
points. Like, oh wow, GE thinks that what I have is valuable and is valuable. And to be frank, I didn't know how valuable what I had was for these
Mm.
organizations.
Hmm.
I wasn't connected to these organizations, so I didn't even understand how valuable it could be for them. So
Mm.
anyway, that was a huge turning point. And then just one other that was really interesting. Our buddy Shahid Shah and I were in the
Mm.
press room at HIMSS. So it's interesting how much of it goes back to HIMSS. But
Yeah.
and we were chatting it up, and he said what he thought my blogs were worth, which I think he was probably a little high based on where I was at the time. But I thought about it, I was like, oh, maybe I don't need the startup. Maybe I can make a go of this media company and it can get me where I want to go. So I'd say
Mm.
that was maybe the next pivotal one, which is like, okay, I can shut down the startup and just go all in on healthcare scene.
Mm. I love that and how, it all, we're still going to hymns, years later, and how it all kind of, started to rumble at hymns and kind of recognizing that, oh, there's something here that, maybe I wasn't, thinking full-heartedly about, but now, being at hymns and hearing, what the audience wants and what advertisers want, really that coming full circle. So that's such a cool insight.
Well, and it's interesting because I came from the ambulatory side because I worked at
Mm.
UNLV in their health and counseling center for students. And so everything I wrote was ambulatory. I remember a
Mm.
CIO coming on, Will Weeder, who was also blogging at the time. He had a great candid CIO blog, and we were kind of, we became blog friends, and we never met for like 15 years and finally met, and it was awesome. But
Mm.
anyway, he came on the site, and I wrote about an EHR implementation I did at a local doctor's office. And he told me a week before, he's like, "Hey, John, I'm opening a new office. I need an EHR. If I don't, then I'll have to like transfer paper. Can we do it?" And we
Mm.
implemented his EMR in a week. And
Wow.
the Will Weeder hopped on the comments and he's like, "You lost me at implemented EMR in a week." Because I was coming from such an ambulatory perspective where that is
Right.
possible, not ideal, not
Mm.
suggested, but we did it, right?
Mm.
But in a hospital environment, that would just never go. Like another example of that, I remember I went to, HIMSS again. I went to one of the parties for Encore Health Resources, and the wonderful Dana Sellers, just brilliant. It was so sweet. This PR lady named Gina said, "Hey, why don't you come here?" And she was so aggressive but super
Mm.
sweet aggressive, like I want to take you, I want to get you what you need and do what it is. And I remember we went to the Tamba Bahamas at Point Orlando, which is not even there anymore. Well, the restaurant is, it's a new one. But and we sat in a booth, and Dana must have been like, "Man, this guy John is an idiot." He doesn't know,
I
but
doubt
she
it.
didn't treat me like that, right? Like she
Hmm.
was so sweet and kind, and she started to educate me on the acute care side and what
Mm.
that was and how the hospitals looked at EHR. And that was like kind of the beginning of my education and kind of realization of what's possible with this niche, because in
Hmm.
my mind it was all ambulatory because that's what I'd done and that's what I knew. And so then when I discovered the hospital side, it's like, oh, this is much bigger than I realized. And there's much
Cracks
more.
it open.
Yep.
And you're kind of talking about topics here, you kind of starting ambulatory and then the acute care kind of, opens it up a little bit. Were there any topics that you thought would be, flash in the pan and gone, but are still around today? And, on top of that, are there any topics that wish had survived and that we're still talking about today? Or you're like, oh, thank gosh, those are in the past. We don't want to talk about them anymore.
I think we're well. It's interesting. Is blockchain gone? But
Mm,
it's interesting when I was pondering this question because you sent it over before. I was like, is there any topic that's really gone?
mm, yeah.
Which is actually kind of a shocking revelation in some way. Like
Mm,
the closest I could come was like, okay, paper charts are kind of done. Like, I
mm.
don't think we're making paper charts anymore. There's a few exceptions, maybe some concierge or something, but it's
Yeah, or
like,
some rural communities maybe are still doing it maybe a bit.
yeah, and there might be a few that are still in storage that haven't been digitized or something like that, right? But like
Yeah.
paper chart is gone. I was like, pagers is like mostly gone, but that's kind of replaced with smartphones. So are they really
Hmm.
gone? Like it's kind of crazy. I mean, fax is certainly not gone. Maybe
Yeah.
that you would think the paper fax is gone, but I heard a story just 3 weeks ago about someone, still using a paper fax and they had to go to digital fax. It was like,
Hmm.
so that's actually the one of the most fascinating things is that almost nothing is gone from what we started 20 years ago. Maybe the command
Yeah.
line interface. 20 years ago, I replaced the medical manager command line interface with a Unix box, straight to a terminal. Like that's gone, I guess. But
Hmm.
like
I don't
that
even know
should
what
have
that
been
is, but
gone 10
sounds
years
like it's gone.
before. Yeah. Yeah. Ironically, it was command line interface, so people loved it because the keyboard's faster than a mouse, right? But it's
Oh, okay,
harder to
right,
train
right.
on and stuff like that. But yeah, so it's actually
Mm,
shocking that things haven't been there, that they have survived as long as they did. And
hmm.
maybe that's a problem, that maybe that's not a great thing. There is one thing that I think was really interesting. There was this company, and I can't remember specifically their name. I should have gone back and found it. But there was this guy who had created an EHR, and he was part of that EMR update forum that I was part of. And
Mm,
he was so advanced. So this is 20 years ago. He had created an EHR where every piece of data was this granular piece of data. And you could
mm,
back up every single piece of data and you could revert anything that you wanted because it was tracked on such a granular level, which at the time was like so far ahead of where any EHR vendor was. It was, back then there was PDF style EHRs that were essentially
mm,
document management systems and things like that. And even today's EHR are not generally that granular, where every single piece of data could be exported to a backup and you could transfer it to whoever you wanted, right? Like he had
mm,
this vision of like, hey, you should be able to access all of your data and be able to do whatever you want with your data. And what's interesting is I don't see that today. We don't see where, Epic or Cerner or Meditech are putting saying, hey, here's every single piece of data. If you want to switch EHRs, you have it all. In fact, there
right.
were many people who were like, I need an HIE. I need a external data source because one day I'm going to leave my EHR and I want to make sure I have all the data. So, it's like that was interesting. That's gone. That idea is gone. We see little evolutions of it in data sharing, interoperability, and things like that. But man, this guy, he was so far ahead of everyone else when it came to this kind of detail.
I wonder where is he now? Is he, still doing, still having these like grand ideas that, could revolutionize the industry? Maybe
Yeah,
not.
I wonder if he got out of healthcare. It would be
Yeah.
interesting.
So John, I want to talk a little bit about, stories and the stories that you told in your blog that you wrote about, I think there's some, you'll probably correct me on the number, what, like 17,000 articles, or are we up to more than that, now?
Yeah, if you include Sway Health, I think we're over 19,000 articles, which is insane.
So that's a lot of education, it's a lot of insights, it's a lot of stories, really, going out to the audience, educating them on kind of what's happening in the space. I'm curious, was there a story or an experience that happened that changed your writing style or your approach and how you were kind of going out to the audiences?
Yeah, there were a couple experiences I'd say that really impacted me. An article I'm really proud of was what I called the video EHR, which
Mm,
now really sounds like the ambient clinical voice AI medical scribe stuff. The only thing I didn't realize is we actually don't need the video, although you could with computer vision and some stuff, like even head that way. But all we needed was the audio. But like I wrote about that in like 2006 or something,
mm,
because I could see NLP working, natural language processing, to be able to identify the data. Like I could see it coming. The only thing that we didn't know at the time was the generative AI. And that
right.
kind of pushed it over the edge and said, oh, now I can take that data and actually create the note. So, anyway, that was a story that was profound. Two stories, though, that I think really were impactful. One was I was at HIMSS again, and had done an HITSM meetup. And there's a guy named Jim Tate that people probably are familiar with if you've
Yeah,
done any sort of EHR certification. If you
yeah.
listen to Healthcare Now Radio, he has a show there. He does a lot of stuff. And Jim's a very direct guy and very strong-willed, passionate person who understands the industry in an interesting way. And we were sitting there about to do this meetup at the Med Decision booth, ironically.
Mm,
So we were standing there, and he's like, John, I'm really impressed with what you've done. It's I don't know how you do it, and it's amazing what you've been able to create, which was awesome, right? Like I essentially created everything in the first maybe 7 years, 5 years of it in my
mhm,
room, in my in my living room, right? And I never met anyone. I didn't go to a single conference for the first 5 years, 6 years. Like I didn't
mm,
meet anyone. I was just creating whatever content I could find. Luckily, Google was powerful and I was able to get a lot of content, great forums and things like that. And so going to the HIMSS conference, it was great to hear people like Jim, who I didn't really know. I knew he knew about certification. I had written a lot about certification. He wondered why I hated CCHIT and why, I didn't like them, and often would say, why do we need certification and stuff? We had those discussions. But
mm,
as we were chatting, he said, he's like, it's great what you've done. He said, John, and he said this really powerful thing. He's like, John, you have influence. And then he goes and like taps my chest. And he's
mm.
like, and John, you better use it for good.
Oh, wow.
And it was like, it's like a grandfather kind of talking to me. He's
Hmm.
got the beard, the gray hair. And I'm like, whoa, okay. Like at first I was like, that's so nice. He says I have influence. That was powerful and beautiful. It was like,
Hmm.
that's cool, right? But it was really nice that he put me on a path and a reminder. I don't think I was doing something that was against that, but he reminded me that, hey, with influence comes responsibility,
Responsibility.
right?
Hmm.
And that I had to be responsible with what I did. And so, it was
Mm,
really nice of him to kind of tell me like, hey, what I'm doing matters and impacts a lot of people, and I should do it in a way that's ethical, that's useful, that's worthwhile for the readers. So anyway,
mm,
that was a cool moment, a little overwhelming at the time, right? Like,
hmm.
what's he saying, But anyway, that was really cool. So
Yeah, I mean, that's such a powerful moment. And I think it also really highlights, the work that you've done since then and the work that, we continue to do now. Because, I think we do have a responsibility that we want to, educate people and give the insights and, what is actually happening within the industry and not always sugarcoating it and being authentic and, telling these stories that actually matter. Sometimes, sometimes there might be some negativity, sometimes there's positivity, but really being authentic in the stories that we're telling.
yeah. Absolutely. And, I think we have a responsibility to do what I call intellectual honesty, right?
Mm,
And people are like, well, why don't you do more investigative, breaking news? Why don't you hold them more accountable? I've actually found that most of the time, if you ask the right questions, they expose themselves. So,
mm,
like, there's no need for me to necessarily get in there and grind away and try to embarrass them or things like that, right? Which would get more views, to be frank. We would get more
mm-hmm,
views if we did stuff like that. But the reality is that if I ask an AI medical scribe, how do you integrate with the EHR? Their answer educates us if they really are integrated or not. And so,
right,
like, I don't need to embarrass them and say, oh, so you're not integrated, right? Like, or that
right.
doesn't sound like a great integration, or, like anyone that's in the industry that understands EHR integration can understand from their response whether that's a deep integration or not. And certainly the CIOs will dive into that. So,
Mm-hmm.
anyway,
The
that's where
truth
I
will
have a
reveal itself.
yeah, exactly. People reveal themselves in their answers.
Mm-hmm,
Do they understand the complexities of the problem or not? So, especially as we've shifted to video, I think that happens so much. The other
mm-hmm,
story that I think really shaped what we do and also shaped this idea that, hey, I don't want to do breaking news, I don't want to do investigative journalism was actually the most investigative journalism thing I ever did. And it
mm,
took me about a month to write a story about practice fusion. And when I
mm,
started it, I thought it was 10 million HIPAA violations because they'd emailed 10 million emails to patients. My estimate was 10, could be 10 to 12 million, somewhere in there.
mm-hmm,
They'd emailed to their patients saying, will you review the doctor? And when they did it, at first we thought it was a HIPAA violation. As we dug in, we're like, oh, they were pretty good about in the email not exposing stuff. There was probably a few thousand HIPAA violations because if you're an HIV clinic and you say, hey, will you rate the doctor at this HIV clinic? Well, you probably release some HIPAA information there because you just said
mm-hmm,
HIV if they were going to the HIV clinic, right?
right.
Problematic, right?
Mm,
But what we did discover is they violated the physician's trust because they didn't ask the physicians, can we email your patients? And it
mm,
was from their very own forums. Like the forums on Practice Fusion were where the doctors were saying, hey, I'm a doctor, and why did you email my patients? There was a
mm,
psychologist who said, my patients are drug seeking, and you're
mm,
ruining the relationship with my patients by emailing them and saying, please rate me as they're
mm-hmm,
trying to seek
mm,
drugs. Like, he's like, this is a problem. And so
mm-hmm,
anyway, took me a month to write the story. I did it. They threatened legal action to me and all sorts of stuff. They tried to berate me in the comments. They fabricated articles saying that they'd announced it, which never existed before the article was published. And
mm,
Forbes went after it. They ended up getting $100 million FTC fine. It was slightly tangential to what I'd written, but that was a huge story. It blew
mm,
up. Of course, for me it was hard because I'm a little cockroach in this world, and they were trying to raise 60-70 million dollars. They ended up raising $70 million after it, so they didn't like that I'd written this story. And
mm,
anyway, it was eye-opening to see people's response to what it was, and to do a story like that. And I
mm-hmm,
realized something. I was like, hey, this is valuable stuff. Like the
right.
people who do this, Erin Broadwin at Stat, like she loves this stuff and she does great at it. But I just realized that's just not who I am. That's not who
Mm-hmm,
I want to be. It's not who I want to show up. I actually said to Shahid, I said, yeah, I'm not doing any of these again. And he said, well, I think it's the most thought leadership thing you did, which I was like, wow, that's interesting.
mm,
But what I realize is this, it's just not me. And what I
right.
realize I am is I want to highlight the stories of success that push the industry forward. And I'm not
Mm-hmm,
saying that there's not a place for investigative journalism, and definitely, man, the traffic from it was great. But
mm-hmm,
it's just not who we are. And that's what I think how healthcare IT today has evolved. We want to
mm-hmm,
tell those stories of success. We want to, sure, and let's acknowledge the learnings in the success, right? The failures that happen as we get to success. That's
right.
valuable too. But hey, we want to highlight the stories of success so we can push the industry forward. And we want people because what I found is that innovation is happening all over healthcare, but it's not evenly distributed. So one of, I think, the missions of healthcare IT today is to highlight those innovations so it can be more evenly distributed. And so I think that's guided so much of what we've done at healthcare IT today was that experience of, hey, this stuff matters, but it's not who we are. It's not who
Hmm.
we want to be. It's not how we want to show up as healthcare IT today.
Yeah, and I mean, and it's such a powerful thing to be able to understand and know what you don't want to do. You can kind of try all these things, and a lot of the time, you can say, that's not for me. You've experienced it, but I know that that's not the realm that I want to take, and that's hard to kind of come to realization. A lot of people can't do that. So to be able to do that and know, and then be able to focus on actually what you do want to do, allows you to really kind of hone in on that path.
Yeah. It was interesting one time. GE reached out to me and said, hey, we have a story for you. It's under embargo. Do you want to tell it? And I was like, I don't know. Do I want to tell this?
I
But
don't know.
okay, yeah, this sounds interesting. Like I'm willing to listen and stuff. And turns out they'd messed up something with their EHR certification, and that was a problem because that means
Mm,
all of their users weren't going to be able to get access to the certification and the meaningful use money and all of that, right?
mm,
And so, anyways, they did this call with me and told me all the story and what was happening and gave me the info. And I wrote the article and I asked them, I said, why did you reach out to me? And
mm,
they're like, we thought you'd be fair. And I was like, wow,
mm. That's
that's
such a great
nice.
compliment. Yeah,
Yeah.
totally.
And so, it was nice that they thought we'd be fair and appropriate, because they knew
Mm,
they were in a bad position, right? They screwed up, right? And so they wanted to own it, but they wanted to own it with someone who would be fair rather than salacious. And I
mm,
think that's guided some of what we do too, right? Hey, we want to be fair. We want to be intellectually, responsive to what's being said, but luckily we have a very highly intelligent audience that knows the
mm,
space well. And if we're not, and if we bring people that aren't bringing quality information and approach to it, our audience knows that. And so we have to hold them accountable to share what's really happening.
sure. And John, you're a fairly reflective person. I want to talk a little bit about, if you could go back to, the young John Lynn 2005 founder version of yourself, what would be one piece of advice that you would give yourself?
It's so interesting because hindsight's always 2020. So it's
Mm,
so much easier to look back and be like, man, I should have done this. But I
right.
think the one thing that I probably would tell, 2005 John Lynn, man, there's a lot that I should tell him, but uh, he was so
Right. So
naive,
how
right?
much time do we have? We could have a whole, reflective session.
Yeah, probably still am naive. But anyways, it was I think, we kind of hinted at this or talked about it a little bit in the previous answers, which is I wish I could have realized what I'd created. Like
Mm,
I didn't know how valuable what I had created could be. And I
right.
wasn't connected with the right people to be able to one understand the value and two to make the most of the value and be able to create the business the way it could have been created, right? Like
Mm,
I could have 10x what I did, but I just
mm-hmm,
didn't have the connections to the people. I didn't
mm,
understand what they needed or what they wanted. And so, that naivety was good in one respect because I just built it. Like I said
mm-hmm,
so many times, I was like, I have way more influence than should be allowed for a nobody in Las Vegas who's
mm-hmm,
writing about EMR from his room, right? Like I did
mm-hmm.
not deserve being listed for so many of the first pages of Google for EMR and related search terms, right? Like
Right.
the quality of the content that I created, if I look back, it's embarrassing. I showed you my first article and I'm like, so embarrassing, right?
I mean, I love
Like,
it.
but it's like, but I'd earned that influence.
Mm-hmm,
So it wasn't that I didn't work to, earn that influence. I earned the influence, but my
mm-hmm,
content and the quality of my content and what I was creating didn't deserve the influence. And so it would have been nice to understand the value that was available and the opportunities that would have been available to me. So I think
Mm-hmm.
that's the biggest one is, and maybe I just needed the right mentors or people that were connected in that space to come
Right.
and be like, hey, John, this is what's available and you could do this. I
Mm,
didn't know that. And so, it would have been great to have someone, that knew that and could have
mm,
guided me in a better way. Things worked out. I was a
yeah.
bootstrapper, still am in some ways. That's still the
Mm-hmm.
mentality, for a lot of different reasons. But that was a big one. And I'll throw in a bonus one. Man, I should have started email way earlier. Like I did
Mm,
SEO so well, search engine optimization. I was killing search engines. I was killing
mm-hmm.
social. And I don't know why I just never did the email newsletter for the longest time. And man,
Mm,
I should have done it way earlier. I would have had so
for
many more
sure.
emails and so many more people. But
Mm-hmm.
hindsight's 2020.
I was gonna say it's so hard because hindsight is 2020, but I love how you said about the influence that you have because it's like you were like the original healthcare influencer before influencers were like really a thing, you know?
Yeah, well, I mean, it's interesting because we go through these cycles of influence, and I think
Mm,
we'll continue to do it, right? Who are the people that they look to know what's going on? And at
mm-hmm.
the time, it was Google. Like
Right.
Google was influential, and if you wanted to learn something, you'd search it, and to
Mm-hmm.
some degree still is today. And now that's
Mm-hmm.
evolving into Gen AI, where my kids are looking to Gen AI and they're
Mm-hmm.
saying, Gen AI, tell me about this, right? And so, and I think
Mm-hmm.
that's going to continue to evolve. They're looking to TikTok, they're looking to different
Mm-hmm.
places. And so I think there's always going to be this opportunity if you understand the platform and the influence that platform can have, then
Mm-hmm.
there's an arbitrage opportunity where if you can leverage your knowledge of the platform to build influence in something
Mm-hmm.
well beyond what you deserve to be able to influence.
Yeah, and I think to add on to that, I think it also goes back to what you said about, GE coming to ask you to write something. It's about, they trust you, they know you're authentic and that you would be fair. And I think in this day and age too, audience are still looking for that. So even back then they were looking for that. People are still looking for that authentic, fair, real voice in this sea of noise that's, happening, with everything in our industry. So I think that's something that has kind of, you know, um, made the company what it is and have people kind of keep coming back to that authentic voice of yours and, what we do here.
Yeah. Well, and it's interesting to see. We see this popping up with like newsletters, right? Like the
Mm,
newsletter influencer, LinkedIn newsletters, the LinkedIn influencer. We see this happening and it's fair. Some of these people don't deserve the following that they have,
mm,
but they create really good content that's authentic and that feels accessible and that feels knowledgeable. And I was talking to a friend, they're like, that person with the newsletter, they have this amazing following, but they don't deserve it. And I said, yeah,
mm,
that's
mm,
normal, that's
mm,
okay, right? Like they're going to grow into it, one. And two, it's also interesting, the other challenge that many of them have though is they start very authentic and then they're like, wait, this is taking a lot of time. How do I make money? And then
right.
they actually alienate the people that started following them once they start taking money, which is why I'm grateful. I had ads on from day one.
Mm,
I had a friend of ours say to me that like John runs it as a business, and it's true. You know, healthcare IT
hmm
today is a business, and its goal is to provide for myself and everyone that works at healthcare IT today's family, right?
hmm
Like
hmm
so, it is a business, but how do you navigate it from a business perspective? Creating content that's valuable and running a business is a challenge, and a lot of these influencers are going to have a challenge bridging that gap.
Yeah, it's definitely a balance for sure. I think we do it very well, but I think it can be a very challenging balance. You kind of talked about, how the business is run, and it is a business. I'm interested in, talking a little bit about the successes, and what the key to success has been for healthcare scene and healthcare IT today.
Yeah, it's tough because it's a grind for sure,
Mm,
maybe that's the approach to entrepreneurship that I take, which is grinding
mm,
it.
mm,
People are like, what makes it special? And I'm like, I don't think I have that much that's special about me and what I did. But if there is one thing, it's that I'm persistent, and
mm,
I stay at something for longer than most, and I'm
right.
not afraid to do the hard things. But I think what really makes healthcare ITD success special is it's all about the people. Like when
Mm,
I think about it, it's the readers and them getting value and continuing to come back, right? Like I am always grateful for the readers.
mm-hmm,
And when I first started, I would do these articles just celebrating 20,000 page views, 50,000 page views. I still do that today when I see, 48,000 email subscribers. Like to me, every one of those numbers is a person who's taking time out of their day to learn from us. And I consider
mm,
that a great responsibility to, provide content that's useful to them. The people behind the sponsors, right? Sponsors aren't sponsors to me. They're people,
mm-hmm,
and most of them are friends, right? That I've connected with, and I want them to be successful as well, right? Like it's
mm-hmm,
really important to me that they come in and the sponsors are getting value and that they're providing value to the readers that
mm-hmm,
read the content that they create as sponsors. And then of course the team, people like yourself that mean so much to me and provide so much to healthcare IT today, right? And obviously
mm,
Colin coming in very early and literally doubling the business in his first year. And I would say Colin made it into a real business. It was
mm,
more of a lifestyle business before Colin joined, and really, upped the level of everything that we did into a full media company in a way that is powerful. But, I mean, so many on the team, right? Grayson
mm-hmm,
doesn't get enough credit because,
mm,
they work in obscurity. I think they probably see Grayson's name a lot now because they're doing the funding and
mm-hmm,
M&A and the roundups of quotes and all this, right? Do so much
mm-hmm,
work. And David actually sends the newsletter,
mm-hmm,
obviously he's my brother, but and which is awesome to be able to work with my brother. But so I'd say
yeah.
it's the people, right? Brian, Beastwood, as we call him, doing all the weekly roundups and bonus features, and Andy Orem working behind the scenes. No one realizes that he's writing a lot of the content that we do and things like that. I mean, there's just the whole, Haley and Bonnie, doing it, and our whole team in India with Ajay and Patosh, right? Like, all of
Mm-hmm,
those people make what we do look good and look seamless. And, it's just so powerful to see how much it is, right? So
mm-hmm,
I'd say it's all about the people. And the other thing I guess I'll just add is that I have a new principle I've been probably saying way too much, which is called sleep at night. It's the
mm,
sleep at night principle. It's like, hey, I want to do stuff that lets me sleep at night. And I think
mm,
that's what's nice about what we do. And it doesn't always work. Like it's not perfect, but our
mm,
goal is, the sponsors pay money to get access to
mm-hmm,
our audience. They provide content through sponsored content, through, white papers, ebooks, whatever it is that they're using to promote their services. We provide that content to the readers who need access to good information, good
mm-hmm,
insight into what's happening. And then obviously we get paid to be able to promote it. And if that works right, everyone gets value. The sponsor gets value because they get a new customer. The reader gets value because they get access to resources that help guide their organization to something, to be able to improve their organization. And we get paid, for connecting them together. And so it doesn't always work perfectly, right? But the goal with every encounter we have, whether it's sponsor or reader, is to create that virtual triangle where everyone's getting value. And I think
mm,
that's the beauty of what we do, is that lets me sleep at night knowing that, hey,
mm-hmm,
we're making a really concerted effort to make that triangle work.
mm-hmm. I love that concept. And it also, gives, I think, us as a team and, as a company, that gives us pride in the work that we're doing and the company that we're working for. Because, if it is just, you know, willy-nilly, it's not giving insight, it's not giving anybody value, it's really not really doing anything, or, it's just for clicks, that doesn't sit well with me, but especially a lot of people, right? So, if we are constantly providing that value and that, as you say, value triangle, that, sits well.
Yeah. It's nice, right? I mean, and that's why I think we have so many friends, is because we do strive to do that. And same is
Hmm.
true on the Sway Health side. If we do a conference for healthcare marketers with Sway Health Live, they come, they get educated, the sponsors get access to these marketers who need agencies, who need, marketing services, who need conferences to be able to promote their products. Then it's that same virtual triangle
Mm.
as well.
When you first said sleep well at night, I thought you were going to say that you developed something that was going to actually make Colin sleep, but I guess that's not.
I, I don't know how to solve that.
That's an unsolvable thing.
The 5 a.m. emails are real.
Oh. So we're kind of almost at the end of our time, John. One last thing, where do you see, what's next for healthcare IT today, and healthcare scene, and how do you envision, the company evolving in the future?
Yeah, it's going to be interesting to see how it evolves, right? I think for us, our core is the same, right?
Mm,
Like if I think about, this is going way back. When I first started in healthcare, like I said, I was working in BYU Hawaii and working there. And I remember I got the job at UNLV and I'm like, wow, I'm going to work in healthcare. And I remember
mm,
telling people, I was like, hey, how cool would it be if something I did actually saved someone's life? That some solution that I did actually impacted their life. And I think that's the beauty of healthcare. I think that's in some ways why a lot of us work in healthcare, is that we could have that potential impact. Now, I might have gotten a bit jaded over the years, the 20 years, 25 years that we're in healthcare, whatever, 20 something years. But it kind of reminds me of the movie Rudy, right? I don't know if
mm, the
Rudy's
best.
there. He's with this guy who his dad was an alumni of Notre Dame and played football. And Rudy asks him, "Why are you still here if you hate it so much?" And his
Mm,
friend says to him, he's like, "I'm under the delusion that one day I might be able to run out of that tunnel." And it's
oh,
like, such a cool moment where he's like,
mm,
this is my aspiration. And I think that's where we're at with healthcare IT today, right? Like
mm,
we're under the delusion that one day a piece of content that we create will create a solution and help an organization to improve their IT usage, that it'll save someone's life, it'll improve their
mm,
life, right? It will improve what they do, it will improve their work life, right? Which then the AI medical scribe improves the work life of so many people, that then improves their family life at home, so that they're not doing pajama time, right, as they call it. Like
mhm,
those types of things matter to us. So I think that will be our focus. As I look at healthcare IT in the future, though, I'm really interested to see how patients are becoming empowered.
mm.
And that is uploading their whole chart to ChatGPT, which is not HIPAA, but yeah.
Beware.
But they do it, right? Like if I'm
Yeah,
dying, guess what? I'm going to upload every single piece of data to ChatGPT and I'm going to say, go for it. I'm going to be
exactly.
dead. Like, so what do I care? Right? Like,
Hmm.
so, like I'm interested to see how patients are going to become more empowered, and the direct to patient services that are going to crop up because now we have so much better data. I
Hmm.
read this something last night about someone from ChatGPT, a former ChatGPT person, who went to a hospital and said, "Man, it's amazing how healthcare throws away so much data. Like
Mm.
Facebooks of the world are watching and seeing how long are your eyes hovering over an ad? How long is your mouse going and about to click something and then doesn't? Like they're collecting every single piece of data. And in healthcare, we don't collect hardly anything. And even the data we do collect, we get rid of in
Mm.
many cases. It's like
Wow.
there's this opportunity to collect data about ourselves. And I saw another interesting diagram. It says what part of the body isn't being worked on by some sensor that's saying,
Mm.
oh, can I do your nose? Can I do your ears? Can I do your eyes? Can I do your hair? Can I do your mouth? Can I do your saliva? Can I do your, you have a watch on your wrist, like every part of your body, you know, I just did a stool sample with the, you know, like with a
Yeah.
company that's looking at my biome, right? Like every
Hmm.
part of your body is being analyzed. And I don't know how far that goes. I don't know how far that's going to go when it comes to monitoring our bodies and how that's going to influence how we receive healthcare and what kind of healthcare we receive and do we do wellness. I don't know. But the nice thing for us at Healthcare IT today is this: I can't see healthcare disappearing.
Hmm. Yeah.
Like we're going to need healthcare. The
Hmm.
bodies are going to break down and we're going to need care, whether that's
Hmm.
through direct to patient or whether that's, you know, I don't think hospitals are going to disappear. We're still going to need someone to do that quadruple bypass surgery one day, right? Like if I
Hmm.
break my leg, I need someone to reset the bone, right? Like I'm going to need certain services like that at a minimum, right? And then I don't see healthcare disappearing and I don't see technology disappearing from healthcare. It's not like we're going to be like, you know what? Actually, we're not going to use technology in healthcare anymore. Like that's not going to
Right.
happen. So, in some ways, healthcare IT today is going to be there for that continuing evolution,
Mm,
or they're going to be a revolution. I'm not sure. I think we see more evolutions in healthcare than revolutions, but you know,
mm,
we're going to be in that spot to be able to have a front row seat to technology and continuing to transform healthcare as we know it.
mm. Well, John, this has been super interesting for me. There was so many things that I think that I knew, but I definitely did not know. So to be able to kind of talk through it with you, and put something out there for our 20th anniversary was, just tickled me. So I'm glad that you were able to sit down with me, and I hope everybody else enjoys the origin story as well.
Yeah, it'll be interesting to see how people react to it, and I hope people, you know, as we celebrate 20 years and all this content, if they, I hope people will hop on social media and share their favorite healthcare IT today story because I think there's a lot of stories that I've never heard. Like I
Oh, for
remember
sure.
someone from Canon emailing me, and they started doing an ad, and he's like, "John, do you want to know why we're doing this advertising?" He's like, "Why?" He's like, "Well, I started at Canon in healthcare." And I didn't know
Mm,
anything about healthcare. And I found your site. He's like, and so for the last 3 years, I would take your blog posts into a meeting. And I'd be like, we need to do this. And I was like,
mm.
I had no idea, right? Like, so I'd love to hear stories of people of how they've benefited from the content. It would be amazing to hear.
Yeah, I'd love that. Well, John, thanks so much. I don't know how to end off this meeting other than like, should we be chanting Rudy or something? Rudy,
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 Rudy.
Rudy.
We should say Brittany, Brittany, Brittany. Yeah, and I guess people should just like and subscribe. Is that how we end?
Yeah,
You know, if you
yes,
like this
that's what we
content,
we
be
need to
sure to
say.
like
Those are
and
the
subscribe.
things. Those are the things. Like and subscribe. We always want to hear, like you said, stories from people, and we hope that you continue to enjoy the next 20 years of content. It's a long time and to be in the biz, but hopefully.
Yeah. Thanks so much,
Thanks,
Brittany. This
John.
was a lot of fun.